President Biden committed to the American people that he would do everything in his power to end this pandemic. And from his first day in office, the president has marshaled a wartime effort to do exactly that. We've been preparing for every scenario, including the potential need for vaccine booster shots. Our approach on booster shots is simple, and it's consistent with our approach on every other front of this war. Be guided by the science, and always, always stay one step ahead of the virus. Now let me turn it to Dr. Murthy to discuss our booster plans, and then Drs. Walensky and Fauci to discuss the science behind the plan. Over to you, Dr. Murthy.
Well, thanks, Jeff, and it's good to be with all of you again today. Today, I want to update you about where we are regarding boosters for fully vaccinated individuals. Our top priority has always been protecting people and their families from COVID-19. And we have been fortunate to have safe, effective vaccines that offer outstanding protection against the worst outcomes of this virus: severe disease, hospitalization, and death. The COVID-19 vaccines that are authorized in the United States have been remarkably effective, even against the widespread Delta variant. But we know that even highly effective vaccines become less effective over time. Our goal has been to determine when that time might come for the COVID-19 vaccines so we can make a plan to take proactive steps to extend and enhance the protection the vaccines are giving us. Having reviewed the most current data, it is now our clinical judgment that the time to lay out a plan for COVID-19 boosters is now. Recent data makes clear that protection against mild and moderate disease has decreased over time. This is likely due to both waning immunity and the strength of the widespread Delta variant. Even though this new data affirms that vaccine protection remains high against the worst outcomes of COVID, we are concerned that this pattern of decline we are seeing will continue in the months ahead, which could lead to reduced protection against severe disease, hospitalization, and death. That is why today we are announcing our plan to stay ahead of this virus by being prepared to offer COVID-19 booster shots to fully vaccinated adults 18 years and older. They would be eligible for their booster shot 8 months after receiving their second dose of the Pfizer or Moderna mRNA vaccines. We plan to start this program the week of September 20th, 2021. I want to be very clear. This plan is pending the FDA conducting an independent evaluation of the safety and effectiveness of a third dose of the Pfizer and Moderna mRNA vaccines, and the CDC's Advisory Committee on Immunization Practices issuing booster dose recommendations based on a thorough review of the evidence. The plan ensures that people who were fully vaccinated earliest in the vaccination rollout will be eligible for a booster first. This includes our most vulnerable populations, like our healthcare providers, nursing home residents, and other seniors. We will also begin delivering booster shots directly to residents of long-term care facilities. For people who received the Johnson & Johnson vaccine, we anticipate vaccine boosters will likely be needed. The J&J vaccine was not administered in the US until March of 2021, and we expect more data on J&J in the coming weeks. With those data in hand, we will keep the public informed with a timely plan for J&J booster shots. I want to emphasize that this decision was not made lightly. It was made with careful consideration by the top medical and public health experts in the Department of Health and Human Services. It was informed by data, thoughtful analysis, and by our collective years of experience addressing illness and epidemics. As always, we will continue to follow the science on a daily basis, and will take whatever steps are necessary to protect our nation from COVID-19. This plan to administer booster doses does not change our commitment to vaccinating those who are not yet vaccinated here in the US and around the world. The overwhelming majority of hospitalizations and death continue to occur among the unvaccinated. We will continue to ramp up efforts to increase vaccinations here at home and to ensure people have accurate information about vaccines and access to vaccinations. We will also continue to expand our efforts to increase the supply of vaccines for other countries, building on the over 600 million doses we have already committed to donate globally. We understand well that global pandemics require a global response and strong leadership, and we will not stop until America and the world are vaccinated against COVID-19. I'm speaking to you today as your Surgeon General, but most importantly as a fellow American who has felt the pain of losing family members to this disease and who hears each day the stories of people whose lives have been upended and forever altered by COVID-19. The brave doctors and nurses in our hospitals, the teachers working to get our kids back to school, and the frontline workers who have put themselves on the line to make sure we can get groceries and supplies. We all want this pandemic to be over. And right now, our quickest path to getting COVID-19 under control once and for all is getting vaccines to those who need them as quickly as possible. So here's what you need to know. If you are fully vaccinated, you still have a high degree of protection from the worst outcomes of COVID-19, severe disease, hospitalization, and death. So we are not recommending that you go out and get a booster today. Instead, starting the week of September 20th, fully vaccinated adults could begin getting their booster shots 8 months after their second shot of an mRNA vaccine. And finally, all of us must do everything we can to protect our communities from COVID-19. That means encouraging our family and friends, our patients and students, our coworkers and neighbors to get vaccinated. That is our path to ending this pandemic.